Patients will often ask me when I tell them they've got bowel cancer, why have they got bowel cancer? People who are very overweight, people who don't do exercise, people who eat a lot of red meat, people who don't eat fruit and vegetables have a much higher risk of getting bowel cancer. There's a small proportion of patients in whom it's genetic.
I didn't know anything about colon cancer at all. In fact, I don't even think I had heard of it. So it was not something that any of the family or any friends, had. So I had no knowledge of it at all. So really, the first that I started to learn about it was actually when I was diagnosed.
I knew my father had had it. I knew that he'd had surgery and chemotherapy, but I didn't kind of really know what it was. I was vaguely aware of some of the main symptoms of it, as in the change in bowel habit and that often people would see blood when they go to the toilet. But other than that, I knew very little about colorectal cancer or cancers in general, to be honest. When I heard the news, shocked. Even though I'd been going through the process of testing and procedures for 12 months, and obviously because my father had had cancer and I went to my GP because of that, in the back of my head I thought there might be a possibility, but I'd gone thinking that I'd rule it out as opposed to that's what it would be.
I had no idea that, I didn't have any perceptible symptoms that would have made me think that there was something wrong.
I don't think you're ever prepared to hear that you've actually got cancer.
Going through the bowel screening test is also a very simple way that will reduce your chances of dying from bowel cancer.